We're supposed to change the system for everyone.
It can take decades to get potentially life-saving medicine to the people who need it, time they don't have.
I think we really underestimated all the work that needs to happen to make the system work.
A process called compassionate use could give you or someone you love access to experimental medicine before it's been completely tested.
These are drugs that tend to be early in development that people want to get access to.
Andrea Sloan has exhausted every treatment option in her battle with ovarian cancer. Since August, we've investigated the barriers keeping her from getting an experimental drug that could extend her life. KXAN investigator Shannon Wolfson discovered a proposed law that could break down those barriers. Tonight, she explains what that reform would mean for you.
That reform can only happen by changing the law. So we came to the United States Capitol to get answers, not only for Andrea Sloan, but for so many other people like her today, and maybe for you or someone you love tomorrow.
It's been really beautiful every minute.
On a beautiful Sunday in September,
I just felt energized and loved and grateful and at peace.
Andrea Sloan is exactly where she wants to be.
Does that help you forget out here? Yes. It's impossible to have a bad day on a horse.
On this afternoon, she's locked in a bitter battle for her life. 2 months after her cancer came back, her body was getting tired, but not her resolve.
I'm not dying of ovarian cancer. I just know it. I don't know how I just know it the way you know things.
She also knows what her doctors told her this summer. Drug manufacturer BioMarin has a drug that could be the best shot at prolonging her life. It hasn't been approved by the FDA, but Andrea could receive it under the FDA's compassionate use exception. Only to get the exception, the drug company has to allow it, and BioMarin won't.
There are just some choices that should be between a patient and his or her physician. And I think there is a commitment in that is starting to take hold in Washington to look at this issue.
So we went to Washington, D.C. and found Central Texas Congressman Michael McCall fighting for people just like Andrea Sloan.
I find too many patients today that are in terminally ill conditions cannot get the life-saving medications they need. And of course, if you're terminally ill, you're running out of time.
McCall is co-sponsoring a bill called the Patient's Choice Act.
It's a matter of life and death for them, literally. And if they don't get the life-saving medication, they'll die. And this bill is designed to get that medication to them.
Patient's Choice would allow drug companies to apply for provisional approval after a drug has gone through the initial clinical trials. It would also give patients with terminal illnesses the option of buying those drugs before they're approved by the FDA.
It incentivizes the pharmaceutical companies to provide these life-saving medications to terminally ill patients so they can get these medications much sooner.
But I guess it's never too late to find a passion.
Andrea Sloan is hardly the only person to run up against a drug company roadblock.
I'm Chloe's mother, and I've watched my daughter battle Ewing sarcoma for 2.5 years.
Take, for example, Chloe Drury, a cancer patient in Britain, denied compassionate use from BioMarin in September 2012 because she was 3 months shy of her 18th birthday, their minimum age for entering a clinical trial. She was allowed in when she turned 18, but it was too late. Chloe died a month later.
We're just sitting there watching our beautiful 17-year-old daughter get weaker and weaker, knowing that there is something out there that she could have had, and it just seems totally wrong to me.
And although BioMarin tells KXAN they support compassionate use programs, the company's CEO said this back in September.
We believe that everybody, all the patients that we try to serve, should have access to the drug in an absolutely equal way. No one has priority over anybody else.
This is a very, very common problem, I will tell you.
Dr. Mike Douglas supervises these labs in Georgetown, where drug manufacturers develop new drugs. He's worked through the compassionate use process and doesn't believe the drug company should have final say.
I think the FDA is the ultimate decision maker. They're here to protect the safety of man.
But under the current system, the FDA isn't the ultimate decision maker. A drug company can refuse to provide a medication through compassionate use, and the FDA can't force them to do it.
The agency doesn't have the authority to require that they make that drug available.
Should they?
There are lots of reasons why companies can't or aren't willing to make those drugs available, and one of them is the cost, the manufacturing. They may not have the facilities or the ability to manufacture enough. The uncertainty about how much demand there's going to be, and if you start giving it to somebody, especially with the internet, everybody finds out, and a lot of people want to get access to it.
Richard Klein is the director of the FDA's Patient Liaison Program. He says the FDA supports compassionate use programs and encourages drug companies to have them, but says giving incentives to make experimental drugs available before all of the research is complete could create other problems because companies would start to make money off these drugs before they're approved. I mean, what in your mind does the future look like for you?
You know, I don't know exactly. I know it will be full of beautiful days. And the gift of cancer is nobody knows how many days we have, but there's something precious about feeling those days speed up because you don't take any of them for granted.
A month after this interview, another company did grant Andrea Sloan compassionate use of an experimental drug, but the cancer had already been growing, and Andrea was growing weaker. Back in the hospital this week,
For the people who need it.
she is still fighting, still trying to get her message out.
No one should have to beg for a drug that potentially extends his or her life. I probably needed my drug 2 months before I was able to get it, and that 2 months would have made the process a lot easier for me. So for all these reasons, I hope that we can all work together and try and come up with something meaningful that works for everyone.
Other lawmakers have also pledged to help reform this system. Congressman McCall tells us he doesn't know when debate will begin on the Patient Choice Act, although it likely will not be before the end of this year. Reporting in Washington, D.C., Shannon Wolfson, KXAN News.
Right now on KXAN.com, we have information about how to get involved if you feel strongly about this issue. And tonight at 10 o'clock, we'll hear much more from Andrea and her own words about how she's doing right now and what she thinks about legislation to help people like her.
If you have a story for our team to investigate, send us an email to investigates@kxan.com or call our tip line, that number on your screen, 703-5255.